Hello students, my name is Moon and this is HE200, the EMT program at Queensborough Community College, and this is the video for Lecture 2. So for Lecture 2, of course you should start here with the main lecture bright space for our class, and then if you go to daily lessons and then click on day 2, well-being of the EMT, which is chapter 2, well-being of the EMT, and this is where you should start, and you should look here because there may be handy things like chapter outlines and other stuff. But for this video, I'm going to direct your attention to the laboratory bright space for our class, and then we go to modified lectures, and then look in lecture 2 here. This is the slideshow I'm going to be running off of because it's slightly modified. You can use the original slideshow perfectly fine. You don't really need this version, but for those who want to follow along, this is probably the better one. This will keep pace slide by slide with what I'm saying. Right, so for any medical emergency, the most important person there to you is yourself. You are the most important person there for yourself, so you have to take care of yourself first, and then your partner second, and then you can worry about the patient after you and your partner are confirmed to be safe, and then other bystanders. What about other EMS and other members of service who are arriving on scene? They take precedence over the patient too. Because after all, if EMS is not healthy, up and about, then we really can't be helping. We aren't around to help other people, right? Also, as you are preferentially treating your other members of service, your brothers and sisters in the system, then hopefully they are feeling the same way about you and will come to your aid when you are having your own crisis on scene. So some title pages and so well-being here. Now, taking care of yourself is not just avoiding accidents or assaults or injuries on scene, but it's being prepared to handle anything unusual, unexpected on scene. So that means being prepared in advance. What does that mean, to be prepared in advance? Does that mean you need to take a martial arts class? No, of course not. You should always retreat to safety. But things like being in reasonable physical shape, you don't need to be Dwayne "The Rock" Johnson or Jackie Chan, but you need to be able to lift 125 pounds, right? Otherwise, you're likely going to hurt yourself with the way weight patients are these days. You need to be properly limbered, good range of motion in all your joints, which means you have to take care of yourself, eat right, stay fit, maintain your medical checkups, your own personal medical checkups, be vaccinated, because if you're here to help others, then the last thing you want to do is give them another thing to worry about, like an infectious disease that you brought in because you were the one sent to that scene. You want to be mentally in a state of well-being. So if they have mental issues, then you need to manage it. You need to seek help for those things that you can't be able to resolve on your own, and you need to feel free to reach out and ask for help among your friends, people you trust, people who care for you, and then finally, if all else fails, then start looking for professional help. All these things come into play, and of course appropriate equipment. Before you arrive on scene, you want to make sure that everything on your ambulance that you're supposed to have is in appropriate working condition. All the batteries are fully charged, nothing is beyond the expiration date, and also make sure that your supply officer and your supervisor aren't trying to force you out there with subpar equipment. So that's part of it too. Being well trained, keeping up with your knowledge so you are best able to handle whatever situation eventually shows up. What about alcohol and caffeine? you really should keep it to a limit. So in the old days, the old recommendations was for males, don't drink more than a certain amount per week. For females, a little bit less. But the current medical guidelines is the less is the better. Alcohol is inflammatory. It is a toxin. Yes, it makes you feel good, but in exchange, you are harming your body. So now, nobody is going to try to make it illegal. The nation tried that a hundred years ago. That was a disaster. So no, they're not going to make it illegal. But the less you drink of it, the better. That's the general guidance now. And caffeine, again, this is the world's most socially acceptable addiction. It's so socially acceptable. People brag loud and clear about how addicted they are and how they have withdrawal effects, and you better not mess with them when they're undergoing withdrawal effects. And everybody else understands. I'm drinking a cup of coffee right now because I need to keep my mind sharper than it would otherwise be as I'm giving this lecture. But again, with every benefit, there are side effects. And so with the benefits of caffeine, there come the side effects of higher blood pressure. And so if you do have issues like that, if your doctor did tell you to reduce your caffeine intake, take it seriously. Search out like nutritionist advice, authorized, certified advice, not just your favorite influencers, so you can take the best care of yourself and get vaccinated. Mental well-being. Part of mental well-being is managing positive, good mental well-being. Part of that is maintaining solid personal relationships at home in your own time. Because if you are in a toxic relationship at home, it's going to show in your performance at work and in your own personal mental well-being overall. Sleep. So EMS is no different. It's a very physical work, and so people in EMS brag about how they say things like, I'll sleep when I'm dead, or sleep is for the weak. Actually, they're in denial. The reality is, the biology is, if you don't get a solid amount of sleep every night, it's going to add up, and eventually you're going to end up having with poor judgment. Your reaction time will be impaired. Did you know that driving sleep deprived is equivalent to driving drunk, driving under the influence? Blood alcohol level of 0.8%. And I even saw it once. I was responding to a call, and we were on the Southern State Parkway in Brooklyn, and it suddenly, on the highway, and then suddenly my driver yelled something, and I said, what? And he said, I was asleep for the last 5 seconds. Not something I want to hear, but yelling about it, complaining about it at that moment was probably not going to be productive. So I did it, even though I really wanted to. So the more you're depriving yourself of sleep, then the more you're flirting with danger. Now you may say, you don't know me, you don't know my life, I gotta do this to survive. And I understand that real life has real problems and real stresses and stressors. So understandable. But I'm just letting you know that, like excessive alcohol intake, excessive sleep deprivation eventually will add up. And then something will happen that is extremely regrettable. So try to make sure you get enough sleep. Okay. Health. I threw this is not in your textbook. I threw this slide in here because I teach other classes here at Queensborough, and I bring up this slide in every class. In the old days, health used to be just a lack of physical complaints. You go to a doctor, or whatever they called a doctor 200 years ago, and they ask you, what's your complaint? And you say, no, I feel fine. Then the doctor says, you're fine, leave, go away. But are you? If you lack physical complaint, if you're devoid of any pain, then are you really healthy? Well, what if you're diabetic and underneath the radar is lurking this hyperglycemia that is slowly eating away at your capillaries, blood vessels, and slowly destroying your organs from the inside out until one day you start to really notice something is seriously wrong. You go to the doctor, and then it turns out you've been a diabetic for the last 30 years. You've done nothing about it. You've had extreme hyperglycemia, which was hinting at some of your funny feelings, but now you've got real organ damage. And you say to the doctor, just give me something to fix it. And the doctor will tell you it's too late to fix it. All we can do now is suppress the symptoms and slow down the rate of destruction of your body. And that's your diabetes. So even though you feel like nothing is wrong, there could be something wrong. So the absence of physical complaint is no longer a definition of health. Then what is the definition of health? So according to the World Health Organization, yes, that WHO that's been in the news lately, in the 1940s, they came to this definition. Health is well-being in the physical, and not just what you feel, but what available tests and imaging is able to show us, mental and social. The mental, people are becoming more and more aware of over the past few decades. Started out when, a few decades ago, when some celebrities committed suicide. And then after that, one by one, all of their friends and other famous celebrities came forward and spoke into the microphone saying, I wish he or she had told me about this earlier. I would have done something to help. So that created public awareness that mental health is not only a thing, but it can also hit the best of us. It's not just something that happens to people who are possessed by evil spirits and should be hidden away, but it happens to real people, regular people. It could happen to me, it could happen to the people I care about. So social awareness of mental health illness started growing. And we get to today, fast forward today, and there is a greater awareness and even facilities and services for mental health treatment. And of course there is in EMS too. Social, that's relatively new, and nowadays we see social illness most loudly or most obviously visible in social media, in internet, and social. There are more there are lots of articles out there talking about how social media or excessive use of social media creates mental health problems such as anxiety, depression. It's FOMO taken to the extreme, and it's causing depression and increasing rates of suicide. Also, performance problems at work, at school, and that's really what a disorder is. Any of these disorders, especially a mental disorder, social disorder, the disorder comes when it's interfering with your ability to perform your responsibilities, which is your responsibilities at work, doing your job properly, your responsibilities socially, like to the people who depend on you, your spouse, your children, other dependents, other people who are relying on you to step up to your half of the social contract. And if you're not handling it, or if you're dropping the ball there, you've got a mental health disorder or a social disorder. And school, if your grades are worse than it would have been. So if you're a B student, don't complain that social media is making you a B student. You're just a B student. But if you would have been an A student and now you're getting C's, and that could be because of excessive use of social media. So it's a disorder when it's interfering with your responsibilities elsewhere in your life. It's making you unable to be a human. Problems in one causes problems in the others. Physical disease inside can start showing up in mental illness and also social problems. What about a toxic social relationship that results in mental illness, and then people actually start showing physical complaints? And if the physician in work with a psychiatrist gets into it, they realize it all started here in this toxic home environment. So these all three interrelate, kind of like three legs of a stool. If one of those legs gets too weak, then the whole thing falls over. So seriously, so this Saturday you will go into skills, and you will learn the step-by-step instructions on how to do various things to take care of your patient. The first line of every skill is BSI scene safety. BSI stands for body substance isolation, and scene safety means you look around, maintain situational awareness, make sure there are no threats to you, your crew, and your patient that are coming from the environment. And it's up to you and your crew to catch that and be aware of it. And if the dangers to you are too great for you to manage, then back out, get out of there, and retreat to a safe distance. Call dispatch for additional resources appropriate to the danger, like police or fire or Department of Energy, electricity, or animal control, whoever has hazardous materials, whoever is best fitted to respond to the situation you just identified. Until they clear the scene and declare it safe, you're not allowed to return to take care of your patient. Every skill set has you recognizing these, the BSI, body substance isolation, and scene safety. This is so important because, after all, you are the most important person there to you, that if you start a skill without acknowledging BSI scene safety, it's an automatic fail. And this is a warning to you, all of you, that 4 months from now at the practical skills exam, you will go from station to station testing on various set of different skills. And when the evaluator says, whenever you're ready, you may begin, and if the first words out of your mouth are not an acknowledgement of the scene safety and that you are properly protected, automatic fail. Automatic fail. You may say on that day, oh, come on, it's just a few words. Why are you failing? I did everything else perfectly. Why are you failing me for just that? And they'll throw it right back at you and say, oh, come on, we've been telling you, making you say these for 4 months, and today is the day you forgot to say it? No, unacceptable, unacceptable. You failed. Goodbye. So don't forget that. You are the most important person there. The equipment and how to use that equipment appropriately for safety, a lot of it has been defined by OSHA, Occupational Safety and Hazards Administration, and also the laboratory version of OSHA, which is NIOSH, N-I-O-S-H. Does it show up? Well, I can't edit this, but anyway, NIOSH is the laboratory healthcare version of OSHA. This is the administration that makes sure that things are done safely to minimize the risk of harm to operators, customers, and the general public in the area. One of the alphabet organizations I told you to write down in the last video on lecture 1. So by now you should have a nice big list of alphabet organizations on that piece of paper. You should add this one to it. So here's an example of some of the things you are expected to wear on scene. So goggles, even if you wear prescription eyeglasses, it's not good enough, because around eyeglasses, prescription eyeglasses, is lots of empty space that blood splatter, patients spit, air droplets can move around and get into your eyes. So prescription eyeglasses are not good enough. Around the rim goggles are there. Anybody who doesn't wear glasses, they need to include this. Or a mask with a face shield. Here is a face shield here. So this is a higher quality than the regular surgical mask. These are a little harder to find. They're a little more encumbering to carry around. It's hard to like jam this in your pockets, right? So there's that. But at least this is a little more protection in case you're getting up close to a patient and suddenly they cough right at your face. This is surgical mask quality protection. These two are N95s. 95 N95 stands for it is designed to filter out 95% of known particulate matter. Well, why can't you get a N100? Well, then oxygen doesn't pass in an N100, so it doesn't exist. Like, what's the point of that, right? But the more stricter it gets, the more expensive it gets, the fancier it gets. So within practical economics, this is like the best you can get on scene most of the time. Different kinds of gloves. This looks like your typical ambulance gloves. This looks like your in-hospital sterile gloves. And these will show up as the time is appropriate throughout the semester. A mantra in EMS, in healthcare, that I've been hearing from the very beginning is that I started in healthcare is always use non-latex gloves because a certain percentage of the population is allergic to latex. But this saying has been going on for so long, I don't know where anybody can find latex gloves anymore. But anyway, if the state exam asks, then you should make sure that you're not using latex gloves for your patient. Gloves should be changed often, frequently, during patient care. Don't feel like you have to use the same glove for the entire encounter with a patient, because after all, these gloves are pretty thin. They can rip, micro holes can appear and you'll never have noticed it. So just change your gloves often. It's okay. How to put on gloves and take off gloves in a way so that the outside of the glove doesn't touch your hand. After all, if you don't do it the right way and like a droplet splatters out and then touches your skin, then what was the point of the glove, right? Microbiology means just because you don't see it doesn't mean it's not there. So always wear gloves when you are in the patient vicinity, especially if you are going to be interacting with the patient. Hand washing. So there is a appropriate way defined by the CDC, Center for Disease Control. Yes, that's CDC. That's been in the news lately. I don't know about anything they've said after 2025 or since 2025, but most of the things they say before 2025 are reliable, believable. And they've been saying, as long as I can remember, that you should wash your hands with warm water and soap at least for 20 seconds, which is about how long it takes to sing Happy Birthday, the song. And now, what if you're not anywhere near a sink, such as your ambulance? Well, then you can use an alcohol-based hand sanitizer. This is not equivalent to washing your hands. There are many strains of bacteria that can survive brief exposure to alcohol, as brief as it takes for it to last on your hands before the alcohol evaporates from your body heat. So alcohol-based does not kill all the bacteria on your hand. And what about the toxins that are on your hands from dirt, from exposed surfaces? Alcohol does nothing for that. The only real way, the best way practically to make sure your hands are clean after a patient encounter is to wash your hands with warm water and soap for 20 seconds. If you can't get to a sink, then you can use your alcohol cleaner, hand cleaner, but that's only okay because it's better than nothing until you get to a sink, like at the emergency room or at the facility where you're going. So there's that video of how to wash your hands and alcohol. Okay, so splatter is a thing. Body fluids. A patient once tried to pee at me, urinate at me. Fortunately, I was able to whip his blanket in front in time, but otherwise I would have gotten a blast, right? I would have gotten a good sprinkling. So eye protection is good to have whenever you can. Some EMTs think or say that it's too inconvenient, uncomfortable to wear all the time. Well, that's on them. That's their decision. Not It's true that they are the most important person there to them, but to everybody else they are the second most important person there. To me, I'm the most important person there. If somebody else says they don't want to wear face protection, then you know what, you do you. I'm going to protect myself anyway, no matter what you say. The mask, this is the duckbill, as you can see. So one good thing about these, here's that NIOSH. One good thing about duckbill pattern is that it keeps that edge of the mask away from your lips. So if anything soaks into the mask, it doesn't touch your lips. That's kind of convenient. Also, as you breathe out, exhale into the mask, your exhaled breath is warm and moist and then coats the inside of the mask, makes it muggy and sticky, and a lot of people don't like that feeling. So to have it separated away from your lips, some people like that. Other people don't like the way it makes them look like a duck. Completely up to you then. Most of the time though, the kind of masks you do get are the surgical masks. Like most of the masks I've seen is this kind without the facial. And it's good. It's called surgical mask because it's good enough for surgeons. So if it's good enough for surgeons, it should be good enough for you. Remember the lockdown, the pandemic? Some of you, it was 6 years ago. Some of you were not even in high school at the time. Maybe you don't remember. Maybe you remember in grade school where you showed up with like cool comic book hero masks and then you exchanged it with your friends for like snacks, like the usual trading back and forth that happens in a schoolyard. So you instead of protecting each other from your salivas, you actually guaranteed that you were exchanging salivas. That kind of a lockdown. Anyway, the rest of us older people, we remember that we were forced to wear masks as well as social distancing. And so those masks at the lockdown time, the public health officials were saying, just wear something. When you go out in public, wear something. Where it can be a bandana, it can be your turtleneck, it can be a gaiter, it could be tablecloth. You can sew something together out of old clothing. Doesn't matter, just wear something. Well, that's for the general public to go into a supermarket. But for actual emergency patient care, that stuff's not good enough anymore. You need to wear at least those surgical masks or better. N95 was even better, but they were almost impossible to get at the beginning of the lockdown. If you ever found one, it was probably counterfeit. And of course, the fashionable EMT, if they could get it, the real swag was they would if they could get their hands on something like this, they really showed off that they had the resources, that they were living the rule of cool, if you could. This pretty much blocked the virus itself. The rest of us chumps had to deal with this if we could get it. So in our ambulance agencies, there was a lot of rationing going on. in the first half of the pandemic, but then by the second half, the supply officers did what they got to do, and at least we could get access to these kinds of masks at the EMT program and at the agencies. So this is best for any kind of respiratory disease and to slow down the outbreak. So now, why were they told to wear the mask if anything was better than nothing? So here's how it goes. The purpose of the masks during the lockdown, and it's still true today, is to not let an infected person spread it to other people. That's the purpose of the mask. A lot of social media influencers at the time got it wrong. They assumed that the purpose of the mask was to stop the virus from going into their mouth. And then they did their research, air quotes, and they found that a surgical mask, and worse, the holes between the threads were larger than the average diameter of the virus. And they said, conspiracy, conspiracy, these masks are useless. But what they totally missed was that that's not the purpose of the mask. The purpose of the mask is that if everybody is forced to wear it, then those who are infected will not spread it to others. And the COVID-19 virus is not airborne transmitted, it's air droplet transmitted. What's the difference? Air droplet transmission means the virus must stay moist in order to stay alive. So the COVID virus must piggyback on a droplet, a microscopic droplet of exhaled humid breath in order to stay alive. Once that droplet evaporates out in the general air, the virus dries up and is destroyed. Some viruses are airborne transmitted viruses, which means even if they dry out, they turn into like a spore, a dehydrated spore, and they just exist like that forever until they land on somewhere moist, and then they rehydrate and reactivate, and they're infectious all over again. But that's not COVID. COVID depends on the respiratory droplet to ride in. So somebody who is infected and then they exhale, the COVID stays on the respiratory droplet, and even something as simple as a bandana, a flap of underwear. Some people were making masks out of underwear, a mask made out of a t-shirt. It caught most of the respiratory droplets and it prevented them from leaving. How did you know it worked? It worked because of the inside of the mask became moist and muggy, became uncomfortably humid inside, and you know it was working. Versus somebody who is not wearing anything at all, and now their ordinary exhaled breath carrying the virus could travel, could eject the respiratory droplet. How far out? Well, in a non-ventilated room with no breezes, an average of 6 feet. Of course, when there is a breeze, when there is a draft, all bets are off. But the average distance it could be ejected to before the air droplet completely evaporated was about 6 feet. That's where the 6 feet social distancing came in. So that's why people were told to wear masks. In school, in our EMT program at school and the paramedic program where I was also teaching, these were not good enough. They must wear these. So this was not good enough. Absolutely forbidden to not to be wearing a mask indoors at the time, and a mask with a plastic tab was also absolutely forbidden, because these masks, the plastic tabs, what they did was it was an outflow vent. But what that means is it took the person's exhaled breath and ejected it in a jet stream and propelled it even further than it would have if they wore no mask at all. Now, the reason why these kinds of masks are so popular is because by letting out the exhaled breath and it's a valve, so it doesn't allow inhaled air through it. Any inhaled air has to go through the fabric. It means then that the person's expiration was sent out unfiltered out into the general environment. But this whole thing was about people who might be infected, and that's why everybody had to wear it. Now, what if somebody came along and said, "Don't worry, I'm not infected, so I don't have to wear a mask"? How do you prove that? There's no way, especially to a non-healthcare professional guarding the door, like somebody at a supermarket or a restaurant. There's no way that a door guard would be able to know if somebody is or is not infected. They'd have to take their word for it. So they would say, "I'm sorry, sir, but no mask, no service. You cannot enter without a mask." Government rules, mayor's rules, city rules, state rules, etc. So this outflow vent mask, unacceptable. No mask, unacceptable. And in class, in a healthcare setting, where the chance of being sicker rises dramatically, in a hospital, in a clinic, in an ambulance, bandanas not acceptable either. You must wear evidence-based healthcare equipment. When you do wear a mask, you must cover your nose, because after all, what's the purpose of the mask? To stop you from ejecting your exhaled breath to other people. So if you cover your mouth but not your nose, then of course you're going to breathe through your nose, and now the mask is just decoration. Some people try to give an excuse like, I can't stand the way it fits on my nose is too big, it hurts, like blah blah blah. They give that advice, but if I cover my nose and the inside of the mask gets muggy and unbearable, look, that's how you know the mask is working. If the inside of your mask is nice and dry after like an hour of wearing it, you're wearing it wrong. You're not using the mask the way it's supposed to work. Some people were wearing the mask like malicious compliance, like my boss says I have to wear the mask or they will fire me. So okay, I'll wear the mask, but then I'll expose my nose so I can be comfortable. And screw the man. Like, I don't care what happens to other people as long as I'm comfortable. So that was the dynamics of masks at the time. Something that I had to deal with, anybody else with glasses, is that no matter how closely you pinched that wire at the top of the mask, a little bit of the breath always came up and then fogged the glasses. I was not able to fix this. I mean, I could do things to reduce it, but there was always some fogging going on. I have no solutions for you. Next time there's a lockdown, if there is one, definitely not this election cycle, but maybe in the future, after the current pandemic management infrastructure is completely dismantled by the current administration, and the next election cycle, the world has to start over from zero of like how to deal with the pandemic, like learn old mistakes all over again. And so that causes another pandemic. Then I'll be dealing with foggy glass lenses all over again, unless they invent a new chemical or something to coat the glasses or something like that, or a new kind of innovative mask. Okay. When you're suctioning somebody, meaning that you found some fluids in their mouth, and so you get the suction device and the machine is sucking out like vomit or blood, and this patient is alive, then there's a very, very good chance that he'll react to what's in his mouth and cough. So this vomit, this blood, whatever, is going to be splattered out in all directions. Having a mask is a good idea. Having gloves is a good idea. In this case, this provider tilted the patient's head so it's not actually aimed directly at his face. Sometimes you're able to do that. Sometimes you can't, because there's risk of neck bone injury, cervical spine, neck bone injury. then you can't be twisting somebody's head. You're going to paralyze him. So you do what you can with what you got, but protect yourself. Some situations you may want to wear a gown, a full front body gown to protect your shirt and your pants and your arms if it comes to that. After all, it's inconvenient to switch out your uniform after a particularly messy job. Most EMTs have a second set of uniforms in their car or in their locker back at the base, or they didn't, and then hope for the best. I don't know what would happen if their front of their front of their shirt is completely soaked in patient's vomit. Not sure what they plan to do about that. Diseases. Although HIV is the most famous disease to non-healthcare professionals, well, since COVID, before COVID, it was HIV. It's now maybe people think of COVID as the first virus that comes to mind. But in the healthcare setting, actually, people are more scared of hepatitis B and C. This is more common, especially with body fluids and accidental needle sticks, which happens in healthcare settings. Much more common than getting an HIV infection. So people in healthcare are more afraid of hepatitis B and C. There is treatment once you get infected, so it's not a life sentence like HIV is, but it's still really, really annoying to get infected. Then you gotta go for several months of treatment, and then if the patient has Hep B, maybe they also have HIV, so the provider has to also get anti-HIV treatment at the same time, just in case. Very, very annoying. So it's really important to avoid any kind of accidental exchange of body fluids, but especially for Hep B. Now, hepatitis B, there is a vaccine. So in order to provide health care in America, you're really supposed to get a Hep B vaccine. And these have to be in triple. You have to get 3 shots the way this virus works. 3 shots spaced a month apart. There is a way to object to this vaccine, to deny it for health reasons or religious reasons or political reasons. You don't even have to say why. You just sign a document saying you refuse the vaccine for Hep B. And I think they allow you to do it because Hep B is ultimately treatable. You'll be inconvenienced for a couple of months, but you don't have to live with hepatitis B once you get it. Still, though, it's doctor's visits, it's copay if you do have insurance. Well, actually, it's workers' compensation. It's a lot of paperwork. Why go through that? Just don't. And also, by refusing the vaccine, which is your right, that means you're a walking you're a walking Hep B carrier. You really want to do that to your patient? Back when I was helping with the interviews for the paramedic program, I would be asking them, why do you want to be in healthcare? And they say, I want to help people. Well, and everybody said that. So is this how you want to help people, by walking around unvaccinated? Why do I Hep C? Well, there's no vaccine. Why not? The hepatitis C virus mutates too fast. The way vaccines work, it can't catch up. So they're trying all the time, but so far they still haven't found a way to nail down something about the Hep C that stays the same generation after generation. So they finally said, all right, we'd rather you have a Hep C vaccine, but we can't get one, so there's that. The reality hits the philosophy hits the reality, and so there is one. TB is a scary, scary disease, because once you're positive for TB, that's it. You of course there's treatment for it, but you will be positive for the rest of your life. And positive, because of that annual TB test where you go get something injected just under the skin called the PPD, PPD, positive protein derivative, and it's like an isolated protein from the tuberculosis capsule, and they inject it under your skin, and then if you have antibodies for it, then it will come up positive. Why would you have antibodies? Because you were previously exposed. So if you have the full-on disease, then for the rest of your life you'll have antibodies, and then you'll come up positive for the PPD test every year. If it's proven that the positive PPD is from an ancient infection and not from a current infection, how do you? To prove that, you have to go get a chest X-ray, so that on chest X-ray they see that it's not a current infection going on. Very contagious, highly contagious, especially in enclosed settings. So yes, it is treatable for ordinary TB, but there has been, for like a couple of decades, there has been a worldwide spread of multi-drug resistant TB. For the MDR TB, multi-drug resistant TB, there's nothing to do for those patients except keep them isolated so they don't spread it to other people, and hope that their body works it out, because there's no antibiotic to give this person to help them fight it off. They are on their own. Supportive care with other things to keep their body, keep the symptoms down, but otherwise there's nothing left to be done. There's no drug that can treat the MDR TB. Which one do you have? Well, only cultures can find out. Bacterial cultures can find out. Airborne, but it has to be in a confined location, like a prison or living with somebody. So just because somebody had TB on the subway and you sat next to them, it's unlikely that you'll catch it from them. But if you were forced to be sharing a confined space for an extended amount of time, then you are seriously exposed and at risk. Like in an ambulance. So it's in one way, you don't want to get it from a patient who might have it, and you will learn about the symptoms of a possible TB infection, mostly history of night sweats and fever, and in this country, travel in the last couple of weeks. So they came from a country that had TB outbreak, and they brought it into New York, JFK Airport, and now they're on an ambulance with you. So if you do, then you really should put on an N95 mask. The regular surgical mask is not good enough. Or the other way, which is you have TB because somehow you slipped through the cracks and the system didn't detect that you had TB, and now you're giving it to one patient after another as you're stuck with these folks in your ambulance in the Midtown Tunnel during a traffic jam. So you need to take this seriously. Okay. HIV/AIDS. So there's been some very interesting news articles in the past couple of years about advances in anti-HIV therapies, seroconverting back to negative, people who were positive come back to negative. So far, they're still in the single digits, as in like less than 10 people have turned HIV negative. Meanwhile, there's millions and millions of people living with the disease, HIV positive. Everybody else, it's a lifelong disease. It works by attacking the immune system, which then makes the person vulnerable to all other infections, which explains what the symptoms of AIDS is, acquired immune deficiency syndrome, immune deficiency. And however, that doesn't mean everybody who's HIV positive gets AIDS, because the level of anti-HIV therapy has advanced a lot. So that people, as long as the folks take their regular HIV medications, then the symptoms are suppressed for their life. and they can live a long, full, complete life, full of professional achievement and full of emotional fulfillment. They can have life partners, they can have children, they can have an ordinary life as long as they take their regular anti-HIV or anti-AIDS medication. They will always be positive though. They will still be HIV positive. Unless that the therapies that's been in the news finally gets to like mass market approval, and then maybe the world will change. Whoever does that really does deserve the medical Nobel Prize for that kind of world-changing innovation. But today, by the time you become an EMT at the end of this semester, the world remains that once HIV positive, assume they'll stay HIV positive, and they are now have to take these meds, which means hope that your health insurance never runs out, or that you end up in a part of the world where these drugs are not available. How is HIV spread? You know, right? Unprotected sex, dirty needles, and in healthcare, accidental needle sticks and contamination of the BSI, body substance isolation, sharing of body fluids. You have to take this very seriously. So what do you do if your patient tells you up front, hey, by the way, yeah, thanks for helping me with my broken leg, but I should tell you I'm HIV positive. What do you do now? Should you wear anything extra? And actually, standard precautions is good enough. Where am I? Slide number... what? Oh, slide 28. Let's go all the way back to the first slide here. Standard precautions. Standard precautions means what you use, what you wear for all patients, no matter what. All patients, no matter what. And that's gloves. Gloves is standard precaution, at least around here. Some may say a mask and goggles also included. That's possible. I'm not going to say not, but at the very least, gloves is standard precaution, and the evidence is that standard precautions is good enough to protect you against AIDS. Now, some clever providers decide, I'm going to double glove when I have an HIV positive patient. After all, you can never be too safe. It's a life-changing disease. The science doesn't back it up. The evidence doesn't back it up. Especially if you're going to be manipulating needles, actually double gloving has its own risk, meaning that the second layer makes it easier to fumble the needle as you're using it, because the second layer of glove is like not fitting as well over the first layer. Pulling on the glove to make it and stretching it to make it fit over the first layer increases the risk of micro holes appearing. So actually that's the evidence, what they say. So why don't you wear like your size gloves and then put a larger size glove over that? Again, these gloves are not perfectly fitting your hand. Anyway, that's the official statement. If the official news is standard precautions are good enough to protect you against AIDS. Every once in a while, a new disease or a scary disease arrives at JFK Airport or Newark Airport from overseas, and then enters the subway system of New York City, and then you got a patient. So you could memorize every disease that comes up in the news, or what you can do is just ask, because if it's an infection, one of the most common symptoms of an infection is fever. Fever is how the body fights infection. The infection doesn't cause the fever. Your body causes the fever, trying to burn out the invading microorganism. So if the patient looks like they got a fever, and it's a good idea to ask them, have you ever traveled outside the United States? And if they say yes, how long ago? And if they say more than like a couple weeks ago, then you get on the radio and say, fever travel, please advise. Because you could be dealing with something like Ebola. Ebola is still out there. It scared everybody long ago, but just because it's not in the news doesn't mean it's no longer out there. It's still out there. It's still out and about in sub-Saharan Africa, and every once in a while somebody infected like that shows up in the US at JFK Airport. So it's a category of viral hemorrhagic fever. Hemorrhagic means bleeding out. It causes people to bleed out of every hole they got and a few more holes they didn't know they got. And their eyeballs and their ears, they just bleed out. It's scary and extremely contagious. One known transmission of patient to person in the United States was a nurse in Texas during the height of the Ebola scare. She was wearing the complete Ebola suit. It looks like a space suit, except that there was like a small gap between her gown and her helmet, and the virus somehow made it through that gap and touched her, and she got Ebola. But I think that was it for the big Ebola scare. I guess we were just well prepared for that. I had to wear that Ebola suit. At the time, we were sent by crews to practice putting it on. So, why did COVID catch the world completely by surprise? Because nobody expected it to be as virulent, as easily spread as it did. When the word came out that there was this new respiratory infectious virus spreading around, everybody thought it was going to be like SARS, because we've been through SARS a few years before that. We've been through MERS a few years before that. So everybody thought, it's going to be more of the same. Yeah, we'll have a few deaths, but we'll deal with it when it happens. And it turns out we completely underestimated COVID. Future diseases. Avian flu is something that the world is worried about right now, and the reason is not because we're so scared about our fellow feathered friends, but it's that if it spreads from person to person, it's a whole new pandemic all over again. Right now, it spreads bird to bird, and that's a different problem. And that, unlike any other animal or human contagion, birds can fly right over borders. They can cross oceans, seas, continents. They don't care about your international checkpoints. They'll fly right over it. So if the avian flu mutates to something even more virulent and then goes from bird to human, and then it mutates so that it can go from human to human, then we got a whole new pandemic all over again. So that's why everybody's so scared. And that's why if the flu ever showed up in like a chicken farm, then all the chickens from that entire farm is destroyed, because they don't want it spreading to the other chicken farms and wiping out the entire chicken industry in that country. That's why egg prices are so high. Flu. So this is not a worldwide spike, but it's always there every year. It's a spike every year. So influenza, it's kind of an endemic. An epidemic is a sudden rise in cases that's unusual, like a one and done kind of a thing. But influenza is an endemic in that every year it shows up again and again and again. In the United States, influenza kills about 50,000 Americans every year. Wait, flu? You mean the flu where, like, if you get it, you get a sore throat and body aches and you're tired for like a couple days and you got a fever, but then after like the third day, you're up and about again and you can go back to work and nobody and everything is back to where it was. That kind of a flu. That kind of a flu for people who are young and healthy. But people who have impaired immune systems, it's a killer. So who should get the flu vaccine? The very old and the very sick. And anybody who takes care of the very old, the very sick. You're responding to somebody very old, very sick, having a medical emergency, and then you didn't get the vaccine, and now on top of what everything else that patient is dealing with, you give them the flu. That's why healthcare providers are required to get the flu shot and the COVID shot. We'll talk about how vaccines actually work. I don't know what you believe, depends on which social media influencers you've been listening to. But when the communicable diseases chapter comes up, we'll talk about how vaccines are actually working then. Okay. So we've seen how the law and medicine are either intertwined or in conflict during the lockdown. It's always been there. OSHA has a thing to say. NIOSH has a thing to say about infection control. If you get exposed yourself, like let's say you're taking care of a patient and you sat down on the bench in the ambulance and you felt a sting and you go, ow, what the hell was that? And you feel around and there's a needle sticking out of your butt because the last crew was playing with needles, left one on the bench and forgot to put it in the sharps container. So now you're exposed. I don't know if you're infected, but you're exposed. What do you do? So you take care of your patient, of course, but at the earliest opportunity, you contact your supervisor and tell them what happened. Your supervisor will initiate an infection control plan, and two things are supposed to happen. First, they're going to call another unit to come take over your patient. And then the second thing is you go to the emergency room because now you are the patient and you have to take anti-HIV and other anti-infectious disease medications to make sure you don't get what you may have gotten. What did that needle contain? Nobody knows. So they're going to give you the works. They're going to give you this cocktail that contains everything that's currently going around to make sure you don't get it. And for the next few weeks, you'll be absolutely overwhelmed with weakness and nausea from your reaction to those anti-HIV and other infectious disease prophylactic. It's a fancy word to make sure you don't get it. Prophylactic. It's a fancy word for make sure you don't get it. We're all adults here, right? So, okay. And then, after you left the emergency room, while you're in the emergency room, before the end of your shift, your supervisor is supposed to come over and with forms for workers' compensation to pay for all of this, the ER visit, the drug tests, the medications. All of this is to treat something you got on the job, so your agency has to pay for everything. That's workers' compensation. But this has to happen before the official end of your shift, and absolutely, for God's sakes, before you clock out. Because if you clock out and then report that you got stuck, then the company can say, this didn't happen on the job. This happened after you clocked out. And now you're trying to claim workers' compensation for something we're not responsible for. See how this works? So you absolutely must report this, go to the ER, and fill out those forms before you clock out so that workers' compensation can pay for all of this. Okay. Meanwhile, what is this infection control plan in more detail? Well, it depends on which agency that hired you. And so when you get hired, you'll get this new employee packet, and they're going to give you stacks and stacks of papers. And one of them is the infection control plan. Now, you may be tempted to just shove it off to a shelf somewhere, treat it like a terms and conditions clause of a website, like don't read it, just sign it. But you really should read it at least once just to get an idea of what's there to do in case of your own medical emergency. So, an infection control plan will include things, statements or clauses about various things like this. Okay. You're transporting a patient and you get a needle stick or other sharps like a scissors or the dirty edge of a metal corner, and you get exposed to patient's body fluids. So now you're wondering, is this patient HIV positive or have any other thing? So when you drop off the patient to the hospital, you ask the triage nurse, by the way, can I find out if this patient is HIV positive? And the nurse turns to you and say, I can't tell you that. HIPAA. Actually, this is actually lecture 4. HIPAA, Health Insurance Portability Accountability Act. And this is a law that's saying that patient information is confidential and it's only to be shared with people who have a right to know. And the nurse is trying to say that you don't have a right to know. So you look that nurse right in their eyes and say, you will tell me because of the Ryan-White Care Act. The Ryan-White Care Act is in two parts. The one part is, if you've been exposed to somebody and now your health is at risk, you have a right to know if your health is at risk. They have to tell you if the patient has a known condition that could be a risk to you. What's the other half? Let's say you're transporting a patient, everything seems to be fine, it's a boo-boo, they stub their toe, whatever, you drop them off at the hospital. And then you leave. You do everything right. 3 days later, after they noticed the patient had a fever and had some curious symptoms, they did a blood culture. And 3 days later, the blood culture comes back and the patient has meningitis, a very virulent, contagious form of meningitis. And so now they have to track down everybody who's ever had contact with this patient and inform them, remember that patient you had 3 days ago? Well, it turns out they have meningitis. Why don't you come in to get checked yourself? That's the other half. Again, it's about your health. You've been exposed. You've been put at risk. You now have a right to know. That's the Ryan-White Care Act. 2 parts. If you missed either a part, then rewind this video, listen to it again. If it's not clear to you, email me or Dan Armstrong for clarification, because this is important, because it's about your health. So airborne, bloodborne, pretty much anything that's possibly infectious and that you've been exposed to during your normal, regular job. Let's see, yeah. So if you suspect that your patient has tuberculosis, OSHA and NIOSH is saying wear at least N95 or HEPA, high efficiency portable air. Let me double check that. High efficiency particulate air, HEPA filter. So N95 is what you wear. A HEPA filter is like installed in the room or something. HEPA mask. What's a HEPA mask look like? Oh, yeah, I guess by now they've invented a mask version of HEPA like this. So I guess it's like one level higher than N95. People who have like a recurring chronic allergic condition are familiar with this term because they have these devices in their own home. And so, they will block you from tuberculosis. contagious, lung disease, and okay, this is AI, this is Wikipedia, Mayo Clinic. Okay, so what am I doing here? I'm not accepting AI automatically. Artificial intelligence has been known to hallucinate. Hallucinate me in this context means they just made it up. After all, where did AI get this information that they're coming to with this summary? They're gathering it from stuff they find on the internet. The internet is not 100% full of pure truth. Can you agree with me with that? Right? There's some false information out there on the internet that's been used to train this AI. So every once in a while, an answer from the AI sounds truthy to somebody who doesn't know anything about the subject, but experts who really will say, what the hell? Where did this come from? So AI is suspect for things that are serious business, like your health, your finances, your legal issues. People may end up using it anyway because doctors, accountants, and lawyers are very expensive. So people turn to AI for the free version of advice, but you get what you pay for. It's free, but it's full of errors. So what I do is always double check the source. This one, Wikipedia, you've heard about Wikipedia, right? Anybody can edit anything. So especially controversial topics, then you have like different factions of the world all trying to edit the content so that it's their agenda. Mayo Clinic. Okay, Mayo Clinic has a long established reputation of medical accuracy. After all, it's a hospital. The Mayo Clinic is a world-respected hospital here. So, and by .org, it means it's not been controlled by the federal government. .org. So the two parts here: Mayo Clinic, established, respected name. .org, it's a non-profit organization. So, which means not controlled by the U.S. government. So this information is still reliable. And here's information about tuberculosis. Do they say anything about drug resistance? Drug-resistant TB. Yeah. I was in a clinic that was treating MDR TB, multi-drug resistant TB. I had to wear a spacesuit. I had to go through an airlock. One of the scariest moments of my life. Okay. So two things: protect yourself, wear N95 or better, and then call ahead, because guess what? The ordinary ER is probably going to say, well, don't bring him here. You're going to expose everybody in the department. Instead, take them to this other place that's better equipped to handle TB and possibly MDR TB, right? So get immunized, get vaccinated, leave your favorite political theories at the door when you become a healthcare provider here in New York State. Remember that mental well-being is one of the three major pillars of health. So you have to take care of your own mental well-being. And EMS is especially stressful profession. The stuff our eyes have seen, not only the spectacular bloody stuff that shows up on action movies, but also the terrors and the horrors that people go through when they're dealing with possibly the worst day of their lives, and also things we've seen that makes us doubt our faith in humanity, the things that humans do to each other when they think nobody is watching. And I'm not just talking about the people on the streets, but people who look very respectable and seem to be like rocks of their community, but then we get a rare access to behind their closed doors into their private spaces, and then we get a front row view of what they do to each other. So these are all stressing on our emotional well-being too, because we're trying to make sense of it all and trying to still believe in our original passion of helping others. Now that I've said the word stress, there is the formal definition, and in psychology, stress is actually the general adaptation syndrome test question. So there are 3 stages of the general adaptation syndrome. The first stage is a reaction to the stressor. The stressor is the thing that causes the stress. So that is the alarm reaction. You see something that stresses you, or that you see something that is a stressor, like a bloody body, somebody charging at you with a knife, or somebody or me handing you the exam booklet for the day. And so you react with stress, and the first stage is the alarm reaction. You get into fight or flight mode, which is you get ready. It's the ancient reflex to get ready to fight or to run away. Flight means to run away. And back in our hunter-gatherer days, back before we were even human beings, this was a very good idea. It was a good adaptation to the environment at the time, because either a tiger was trying to eat us, or a competitor in the village or in the clan, the family group, was trying to compete with us for something we both wanted. So either we could overcome the stressor and we fought it out, or we decided, we noped out of there and decided, no, I can't beat this thing, so you run away. And the alarm reaction primes our body to be ready for this kind of action. Well, these days, a stressor is not physical. It's not a combat-related situation. It's like an exam, or it's when the bill comes in and you don't have enough money to pay for both the bill and food. When somebody is giving you a summons, or somebody is suing you in court, and it's triggering this alarm reaction. And your body is trying to get ready to fight this physically, but it's like the absolute wrong tool to deal with modern stressors. So you have the first reaction. And now, after your first reaction, then you sit there and see what you can do about it, and you try to resist the attempt of the stressor to get you out of balance. All the time your body is trying to stay in balance. It's called homeostasis, and that word is going to come up later. But right now, your body's trying to stay in balance, and now a stressor comes along and tries to push your body out of balance. So your body reacts in various ways to get back into balance, and we can call that coping. Now, psychologically, it's also called coping, where you do your mental gymnastics to try to find rationality out of this horrible situation, intellectualizing it, or somehow trying to convince yourself that you're not the bad guy, or that everything is happening for a reason, or something to just make you feel like the world is still the way, your worldview is still the way it really is, etc. So this is going to continue now until it ends. And it will end either one of 2 ways. Either the stressor will go away, either the tiger finally decides, I don't think you're worth it, and stops chasing you, or the competitor says, fine, you win, you can have it, and walks away. So the stress is over, right? Or your the boss calls you in for a meeting. You thought you were going to get fired, but the boss says, I just wanted to say you're doing a good job. I'm gonna write a letter of recommendation that you get a raise. So the stressor is over. But then everything's resolved. So it's not a matter of stress anymore, right? So that's one way the stressor can be finished. But there's another way, which is your ability to resist is over. The stressor is still there, but your ability to cope is no longer adequate, and it completely collapses. And that's the exhaustion phase. Your ability to resist has failed, and so you decompensate. You collapse. You do stuff that is regrettable, or you regress, or you do other kinds of psychological maneuvers and that turns into a disorder. results in the disorder. So, how do EMTs experience stress? Well, like everybody else, they experience stress like all other people do. But then they have this extra stressors from the job itself, where it exposes our eyes to some horrible scenes, both physically and emotionally and socially. And then the EMT starts experiencing mental, psychological, and then physical and even social symptoms to what they've experienced. Many of us are able to handle it either because what we saw wasn't actually that stressful or that much of a stressor. Either we expected it, or the things we've seen aren't like the worst humanity has have to offer, or some of us have seen some really, really bad stuff, but our ability to cope, our social support structures, our mental preparations, our physical well-being, all contribute to helping us cope with this extreme stressor situation. But some of us are not that lucky, and then eventually it causes such a mental disorder, health disorder, that the person needs professional intervention, such as PTSD. PTSD, I just want to make clear, is not only about how severe the experience was. It's about how well the person can handle it. Some people went off to war and saw some really horrible stuff, but then came back okay. Not everybody who went off to war came back with PTSD. So some people were able to handle it with what they saw. Some people saw stuff here in the neighborhood, and they were so unable to handle it that they get PTSD. PTSD are signs and symptoms such as like recurring nightmares, avoidance to the extreme that causes a disorder. Remember, to be a disorder, it has to impair function in your responsibilities at work, at school, in relationships. So you're unable to meet your needs to function as a productive person. So when somebody is showing the signs of PTSD, don't try to fix it by telling them, you've seen nothing, I've seen worse, look at me, I can handle it, why are you being such a baby? That's not the way to treat PTSD. What this person needs is a psychiatrist, somebody who is an expert in dealing with this. After all, if somebody has a bone disease and carrying anything heavier than 10 pounds causes their knees to fracture, are you going to tell them, why are you being such a weakling? Why can't you carry your weight? Look at me, I'm carrying double the weight and I'm fine, so stop being such a baby. Is that what you're going to tell somebody with a bone disease? And you may say, oh, come on, everybody can see if somebody has a bone disease. And that's the thing. With psychiatry, you can't see it. Only people who are trained to look for these signs can. PTSD is one of the delayed stress reactions, meaning that when you're actually on the scene experiencing the event as it's happening, you may feel fine. And then your coworker says, man, that was some crazy stuff. Are you okay? And you say, I'm fine. And then the supervisor sees you at the end of the shift and says, hey, I heard what you did out there. Good job. Are you okay? Is there anything you want to talk about? And you say, I'm fine. And then you get an email from the critical incident stress manager and say, I heard what happened out there. Is there anything you like to talk about? Let me know. And you reply, I'm fine. But then days later, months later, suddenly you get the shakes, you get the night sweats, recurring nightmares, avoiding the place. I mean, going really, really out of your way to avoid the situation or the location or anything that reminds you of the place, and you're starting to show signs of PTSD, and then finally start to impair with your regular function as a human being. Delayed stress reaction. It's no one's there now to follow up with you. You need to recognize this, what it's doing to your life, how it's dismantling your life, and so you need to search out for help. Call those people back and ask for help. I'm basically saying, don't diagnose people, because that's not our job. In EMS, whether you're an EMT or a paramedic, our job is not to diagnose people. It's to be there to help people if they need that help. Cumulative stress reaction is when it's not one big bad, but it's a lot of little bads that just build up over time, over the months, over the years, until finally something in your mind says, that's it, I've had it, I can't take it anymore. How do you know you've reached that point? Again, it's interfering with your life's responsibilities, and your world is being slowly unraveled because you don't have the structure anymore to hold it up. Severe withdrawal, suicidal thoughts. These are not unique to cumulative stress reaction. It's a stress disorder and mental health illness in general that you'll see this in all of them. What can cause us stress? Well, you name it. It's all about the person's ability to cope. It's not really about the event itself. But these are like the things that have been seen out there. I had a coworker who had his previous partner killed in a when they were responding to a motor vehicle accident, and he's never been the same since. He has been his self-confidence has been absolutely shattered, and I wish I could have done something for him, but he refuses help. It's really tragic to him. And these are just the usual suspects, but there's many other causes, stressors that cause the stress. Did you know there's a good stress? Usually in our regular English conversation, we think stress is only bad because, in our modern society, we don't have tigers chasing us anymore. Most of us go through life without ever getting into a life-threatening fight. Maybe the last fight I was in junior high school. So that's not our body response to stress is no longer helpful in responding to stress. But there are times when you do want your body to activate that sympathetic nervous system response because it helps us be better. It helps us bring out the A game. And what does that mean? When you are a little bit stressed, then you focus in on the exam better. When you are in a competition, then your heart is pumping faster and harder. Your muscles are twitching faster. Your non-emergency body functions are being suppressed. Your blood sugar is elevated. Your eyes are dilated. All these things to help you be better at the competition. So you're bringing your A game. You're rising to the occasion. That's all eustress. When you use the stress as like a source of energy to propel you to perform above and beyond at your job, at school, at a work location, to reach your peak performance, that's eustress. All of these, however, are typical in that they don't last a long time. If stress symptoms continue for a long time, that's chronic stress. All these positive things that happen to your body under stress are not meant to be sustained for a long time. If they keep going for a while, if you never give your body a chance to wind down, to turn off, that turns into chronic stress, and that usually results in things like this. So, not you, but maybe your partner. Your partner is starting to show some of these signs of stress. Then what should you do about it? Well, the answer is go ahead and ask him. It's pretty simple. Now, it really depends on how close you are with this person. It's not because they're your partner, but you're doing it because they're your friend. Um, many partner pair ups uh, ends up, especially if it lasts over months to years. And every once in a while, if you're lucky enough, you'll be partnered with somebody and you two will really click. And it's like having your best friend because you're in the same industry, you're sharing the same experiences, you're growing together, you work off of each other, you complement each other, you find that you two think similarly. You reach a state where you almost don't have to talk. You can perform at the job at the emergency like a well tuned team. So you have really gotten close to each other, and there are many partners out there who know each other better than their own spouses. So when you have reached that kind of a trusting relationship with each other where your defenses are down and now you know this person well enough that something seems wrong lately, and now you can come out right out and say it, like, you've been acting weird lately. Is there anything you want to talk about? Or are you still thinking about that thing that happened last week? So start out innocently, start out friendly, and just the whole point of it is to let them know, first of all, that you've noticed and that you care. You're not trying to use them for policy or agenda, and they should know that about you because you two are that close already. But they know that you do care, and that if there is anybody that they could be able to talk to, it's you. There are sometimes some things that they people just cannot talk to their spouse about. And EMS sometimes, if the EMT has a spouse that is not in healthcare, then that spouse just will not understand and may default to like simplistic solutions and why didn't you try this, and they just do not get it. So talking to somebody in the service helps break down some of these barriers, these defenses, and then whatever they say, you go from there. Now, if they do say something really scary, it's up to you to decide if you want to rat them out. And because if you jump the gun and hit the panic button, and what this person will learn is that you betrayed their trust. They thought they told this to you in confidence, and now you just told your supervisor that, hey, I think my partner's thinking of suicide. Or maybe that's what you got to do to save their life. Maybe the things they're saying made you really did make you scared that they are about to commit suicide. So maybe you should bring this alert to somebody who's able to do something about it. Then it comes down to, like, do you want to live knowing having this person? Do you want this person to go on living feeling betrayed by you, or do you want to let them kill themselves? So of course there's no simple answer. This is not a question and answer thing. It's about thinking about it. But those are the dynamics you're going to deal with. But the point of this slide is that don't feel afraid to come out and come forward and ask. Simply ask. If the conversation gets to that topic and it does seem like now's a good time to ask, it's okay to come right out and say, are you thinking of suicide? If they laugh it off, they joke about it, okay, well, you asked. But it's possible that in their mind they have their logic has become so twisted that they are seriously considering it, and it could be that they feel like they've been locked into a corner. They've trapped themselves into a corner where it seems like suicide is the only actual logical solution. Obviously, that's not. Suicide is never a logical solution, but in their mind, their mind is diseased, just like a bone gets diseased. Their minds gets diseased to come to this pathological conclusion. And you simply asking might be a window of escape for them psychologically. That if they do take this rare moment and say, I need help, here was your opportunity to save their life. So some things to look for, and this is not a checklist, this is not 100% guaranteed to be accurate, but just some ideas to look for about things, changes that you may see in this person you thought you knew well that's now making you concerned. You heard me say some letters earlier. CISD, Critical Incident Stress Debriefing, is part of the overall system called Critical Incident Stress Management, and it's something that EMS agencies are actually trying to implement, which is that sometimes their crews see some really horrible stuff, and it causes their crews, their employees, to slowly or quickly, but often slowly, cycle into a mental illness disorder, and then sometimes there's suicide. Actually, suicide rates in EMS is 10 times higher than in the general public. So to help responders have an extra resource, that there is a critical incident stress debriefing. And what happens is a trained peer counselor or team meets with the crews who've had a serious experience, a really bad experience, and helps them talk it out. And then leaves it up to the crews, the individuals, if they want to seek further assistance. The way it's been actually implemented in real life is variable. Some people are saying that their agency is treating it like a joke. Some are saying that their agency is being a little too heavy-handed with it because this science is a little new. It's slightly relatively new, but at least it's a great improvement from like 20 years ago where none of this was considered at all. And back then, the policy of agencies was tough love, suck it up. If you can't stand the heat, get out of the kitchen, kind of a thing. So managers didn't want to hear it at all a few decades ago. At least they are now trying to help. Maybe they're not doing it perfectly, but at least now they're trying it. And so for the next few generations, there's going to be a lot of trial and error, seeing what works, what doesn't work. But at least management is now trying to help. That's for the EMTs. Now, what about stress with your patients? Again, this could be the worst day of the patient's life. It could be the worst day of their family's life. How to deal with it. Actually, you're going to... there's a whole separate course on this called PTEP, Psychological Trauma of the Emergency Patient. We don't actually do that here at Queensborough. I wish we did. Let's see if I can get some of that resource started with this class. Anyway, not only are you there to splint a broken leg, not only are you there to provide CPR if needed, so these are all physical things to do, but you're also there to provide psychological therapy with a little bit of training that you've been exposed to. We will have like a short psychology lecture, which is nowhere near enough to deal with the real problems out there, but at least we're trying. So, and the main thing here is that sometimes, the main takeaway I'd like you to get is that sometimes the best thing you can say is nothing at all. I think that the philosophy of EMTs is that they started this job because they want to help people. Here's a person undergoing obvious psychological being psychologically distraught. And so the EMT feels like they have to say something, they have to do something. When this time in this situation, maybe not. Sometimes the best thing to say is nothing at all. Instead, the most you may want to say is like, I'm here in case you need my help. But otherwise, let the person cry it out. Let the person say what they want to say. Just be there, be active listening, be there to be supportive, compassionate, and also professional too. With stress and death, you've heard of the 5 stages, so you already know what the 5 stages are. If you're not sure, this one is safe to search on the internet for, because I haven't seen any variants of explanations that are like out and out wrong. So I'm not going to tell you what each one of these mean, but I want to say that this is not a checklist. This is not a sequence. The patient doesn't have to go in this order. Patients are allowed to go in any order. They don't have to hit all 5. They can hit one only and never reach the other 4. They can go in cycles. They can go in the opposite order. These are just things that patients show when dealing with excessive stress or fear of death. So don't treat this like a checklist or an order. I'm just telling you that. So sometimes the best thing you can do is not to do anything. Just be there and listen empathetically. How do you do that? Well, that's a lot of non-verbal cues, body language. Never falsely do anything, but absolutely do not falsely be sure. Don't say anything stupid. Don't say things like, they are with God now. That just starts a whole firestorm, that phrase. You are just asking for it. You feel like you need to say something reassuring, so you say, don't worry, they are with God now. Whose God? Your God? Their God? Thor? Whose God are they with? How do you know? You just open yourself up for blowback and reaction. So don't say stuff like that. If the child is if the parents lost a child, don't say something stupid like, you can always have another one. Sometimes if you feel like you need to say something funny, just don't. If you can't think of something professional to say, just don't say anything at all. Let the family cry. Let the family seek closure. Do everything you can according to the protocol, so that you can tell yourself as well as tell the family that you seriously and honestly did everything possible. After all I've said about stress and psychology, I need to say one more thing, which is I am not the expert. Yeah, I did have a psych rotation for about a month, and that doesn't make me an expert. That makes me somebody who knows just enough to cause a lot of harm. So it's possible that something or everything I just said is absolutely wrong compared in the eyes and ears of somebody who really knows what they're talking about in terms of patient psychology. I'm mostly relaying what I learned in school and what I've seen out there. I just wanted to say that as a disclaimer. Scene safety. So, is there anything in these pictures that make you cringe, or at least worry that maybe I need to be extra careful? I think this is a joke. This is made back before the days of artificial intelligence, but I'm thinking like, is this possibly Photoshop? Anyway, this is a scene you could be in a lot. This is a very common scene here around here in New York, and so all traffic is narrowed to one lane, and that means that there's a good chance that one of these drivers is distracted or drunk or sleep deprived and completely missed all of these signals and they're just waiting to barrel into you. So this is a very dangerous scene no matter how many safety devices you're using. This one, I would just nope right out of there. I think this guy is way too close. I don't see a line of police officers protecting this ambulance, and if the crowd gets angry enough, they start to look for people for signs of any authority, and they stop caring if you are representing healthcare. They just, especially if you're outside the ambulance, now you're in a uniform and looking official, so they may see you as a target. I was once chased by a guy with a machete. I was in the ambulance at the time. So I told my driver, well, drive away. We must drive faster. And that was all it did. That's all it took. We were already leaving, and so we just turned the corner and kept on driving. But that means it's a matter of like, if he chose to attack only a minute earlier, then the story would be different. Scene safety, right? All the ways that the scene may be dangerous to yourself. Hazardous materials, or hazmat. There's an entire chapter dedicated to this at the end of the semester. And then I will show you a special app you can use to decode these placards that you see at the back of trucks, container trucks, and stuff like that. The Emergency Response Guidebook. Ever seen these? So maybe you've seen these as a public citizen, right? A bystander. So it didn't matter to you what they meant. Well, what if you show up as an EMT responding to a truck rollover, and now you see it's not just like a regular cargo truck, but it's some kind of metal cylinder with these sticking out the back. And now, is it worth your while to figure out what they are? Absolutely. So using the ERG, you can tell this. If not, you can always call through the dispatcher what you see. Like I see a red placard with a flame on top and the number 2 on the bottom, and the number code in the middle is 1075. And the dispatcher will take this information, forward it to the fire department, who will decode it, and then they will know what kind of hazardous material they're responding to. What do you do in the meantime? Get the hell out of there. What if it's a gas? What if it's toxic waste? Who knows what these are? It's not your job to know the difference. It's the fire department's job. Your job is to identify and make sure you always stay safe. Binoculars is part of your 800, which is the list of things you're supposed to have. So you should be able to see this from a distance. How do you know you're far enough away? Well, one thing you can try is this. So this show is very popular this year, and people think, one thing I didn't like about what the TV show was doing was that it made the lore about this guy as if he's being positive. Actually, that's not why he's doing it. Because look at the shading. You see how the front of his face is brighter than the side. You see how the front of his thumb and knuckles are brighter than his palm. And there's some kind of light source in front of him that he's holding up his thumb. This is called the thumb test. If you see a hazardous materials incident, what you do is you hold your arm out, arm's length, stick up your thumb, close one eye, look through the other eye. And now, if you can use your thumb to completely cover the image of the hazardous materials, like the cloud or the fire or whatever, then you're probably far enough away. If not, if some of that image is like peeking out from either side of your thumb, you're too close. So get in your ambulance, turn around, and get further away. So as a hazmat situation, it means for you is recognize, and then safety, notify. Recognize, safety, notify. If there's a patient coming out of that hazmat area, don't let them touch you, because they're contaminated. If they touch you, you're contaminated. So you get on the accelerator and drive even faster. Don't let them touch you. Don't let them get in your ambulance, not because then your ambulance is contaminated. So retreat to safety. Terrorism is another chapter at the end of this semester. Very real nowadays. So we'll talk about it, but it's all about making sure you're safe too. Rescue operations in general is not the EMT's role. The EMT is supposed to recognize this is a potential rescue operation and call for additional resources. Just because you're in a uniform and just because you're responding to a 911 emergency means that you are a potential victim of violence. Don't say stupid things like, don't they know I'm here to help? No, they don't know. They don't know your equipment. They don't know the signs, the patches, the stuff like that. They just know somebody in a uniform is approaching their house. And there are stories of EMTs who were shot at as they try to enter somebody's property. So you need to always be aware that violence could happen at any moment. You see how these crew members are standing off to the side when they're knocking on the door, not standing right in front of the door. So that's a good idea, even here in Queens, New York. Should you wear a bulletproof vest? When I was on the ambulance, I never did. And I am just secretly thankful that it never came to that point, because I'm usually too hot. I'm usually too warm no matter what the situation. So the idea of wearing a bulletproof vest under my uniform just fills me with dread that I would just be sweating all the time, because it's like a sweater. But I'm hearing that more and more agencies are issuing bulletproof vests to their crews because our society is getting more and more dangerous. Wear your equipment so it doesn't dangle so much. I know it's more cool to have things hanging off of clips and hooks and like that, but a little more secure. Having devices and equipment more secure against your body means that they're less likely to get tangled as you try to escape from a dangerous situation. Always carry a portable radio wherever you go. Don't let one of your crew carry it, which gives you the excuse to not carry it yourself. The both of you should be having that portable radio. And everywhere you go, always keep half a mind on how best to exit. Keep half your mind memorizing how you got in there and how the fastest way it is to get out there. And one more thing I should add is never let the patient get between you and the exit. Like you enter somebody's bedroom and they're sitting on the bed. Don't walk around the bed, so that now if you need to suddenly escape, the patient can intercept you as you try to reach the door. Always be between the door and the patient, so that way you can always back out. Always be between the door and you in the ambulance, so that if the patient turns suddenly violent, that you can always have an escape. And your escape is either the double doors in the back or the side door in front. So as you approach, does the scene look sus? Is there anything about the scene that gives you this funny feeling that things are not completely safe? If you ever get that feeling, call for police if they're not already there. If they're not already there, wait. No one will ever get you in trouble for not entering a patient scene because you didn't feel safe. There was one time where we responded to a psych patient call at a motel. And so we arrived. Police were not there yet, so we just put it in park and wait. And then after a few minutes, somebody came to my window and said, "I'm the manager. Are you the 911 I called for?" And I said, "Yep." And he said, "Aren't you going to go up there?" And we said, "Nope." "Why not?" "Well, police ain't here yet." "But you have to come up. This guy is is running up and down the hallway, banging on all the doors. Oh, we're definitely not going up now. So we waited till police arrived, cleared the scene, and then we went up. So you are always number one. With psych calls and potential violent incidents, we are advised to not have lights and sirens on approach. All other calls, we usually have lights and sirens on because no matter what the call type is, maybe the caller got it wrong or the dispatcher misunderstood. So even though it sounded like a no big deal call, it turned out to be it is. So we always go lights and sirens, except a possible violent scene, which includes a possible psychiatric scene. So for those, we just go lights off, the emergency lights off, and no siren, which means we have to obey all traffic rules, because without lights and sirens, there's no way to warn the other motorists that we're not obeying traffic rules. Drive by first so you can get a good look, and then when the scene looks safe, then you can go find a parking spot. And then as you enter the scene, if everything outside looks safe, then as you enter the scene, look for things like this as a clue that inside the scene may be not the safest. There are no bad dogs, but there are bad owners, and there sure are a lot of bad owners. You can ask the owners to secure the pet either in another room or in their already well-known cages so that you can properly take care of the patient. If they refuse, then you get out of there. After all, if you're treating the patient and the patient starts wailing in pain, not because of what you did, but because what they're going through, what if the pet decides you're causing the pain? And if the family refuses to secure the pet, they get out of there. What are they going to do? Fire you? You can always get another job, but you don't get another body. So you are number one to yourself. Scene safety, always more important. When there is an obvious, clear, and present danger, then retreat. Once you are safe, radio it in, and then reevaluate as you wait for PD and other units to arrive. Let's see. You have no business being on the scene. They have their own EMTs. It's called in New York. It's called ESU, Emergency Services Unit. They're New York's version of SWAT, SWAT EMS. So what happens is, if you want to work in ESU, you become a paramedic first, and then you work 911 as a paramedic, and then you join the police academy and you graduate from the police academy, and then so now you're a paramedic and a police officer, and then you go to extra training like SWAT training, and then you graduate from that, and then you are ESU, and now you're issued all your EMS equipment and guns and body armor, and you walk in with them. You charge in with them to deal with the scene. Since you are not SWAT, you get safety. You run away. What's the difference between cover and concealment? So cover just blocks the assailant's view of you. Concealment blocks the assailant's view of you. Cover actually blocks the bullets. So is this cover or concealment after what I just said? Right. So thank you for your patience listening to me, hopefully not at normal speed, for chapter 2 of wellness. And it's time now to move on to the next chapter. So you'll see me in the next one.